Let's take a look at CPR. CPR is an abbreviation for cardiopulmonary resuscitation. This method is used when an individual is unresponsive and is not breathing. The CPR technique that a person will receive will depend on their age, but no matter what, you must always pay attention to their ABCs. ABC stands for airway, breathing, and circulation. Check whether their airway or mouth is clear, whether they are breathing, and if they are bleeding profusely, since it can cause a problem with their circulation. Doing CPR on adults and children. First, lay the person down on their back. With one hand on top of the other, place them in the middle of the person's chest. Push down to deliver 30 steady compressions. Use most of your upper body strength if you need to. For adults, push about 5 centimeters or 2 inches deep. For children, push about 1/3 deep. However, when it comes to babies, this is where they differ in the slightest. Instead of using 2 hands, we only need 2 fingers, usually the pointer and the middle one. Do chest compressions at about 1/3 deep as well. Allow the chest to recoil before administering another compression. The next step is to administer rescue breaths. To do so, open their airway by slightly tilting their head back and lifting the chin. Take the barrier device in the first aid kit, put it over the person's mouth and nose, and give 2 breaths. If a barrier device is not available, instead, pinch the nostrils and do mouth-to-mouth resuscitation. Repeat the cycle of 30 compressions with 2 breaths until the person becomes conscious. Always check for ABCs every cycle too. If CPR doesn't work, use the AED to help restore normal heart rhythms. There are correct sized electropads for the immobilized person. There are ones for babies, children, and adults. Remove anything that could prevent the pad from sticking, for instance, a piece of clothing. If the skin is wet, pat dry as best as possible. Take one of the pads and stick them on the right side of their body, just below the collarbone. Next, stick the other one on the lower left of their chest, just below the breasts. Turn on the machine and follow the AED automated prompts. Make sure no one is in contact with the person before administering a shock. Afterward, continue giving them the CPR cycle.